Hello and welcome to today's special Gulf News webinar, Healthy Ramadan Fasting with Health Conditions, brought to you by Fakeeh University Hospital. As the month of Ramadan draws near, Muslims around the world are preparing to fast from dawn until sunset every day, followed by a nightly feast with family and friends. But for those with medical conditions, fasting can present some challenges that can be difficult to navigate. Now, fasting carries many health benefits, including detoxification, readjusting hormone levels, and even cell repair. But for those with pre-existing medical conditions, they need extra care to make sure that their fast enhances their health rather than worsening it. Patients who are often challenged include those with diabetes, heart, and kidney conditions. And whether you are newly diagnosed with diabetes and unsure if you should fast, or maybe you're a cardiac patient on medication and you're wondering whether fasting is going to be safe, or you might be worried about your high blood pressure and how that is going to be affected by fasting. This webinar will be answering all of these questions and many more. My name is Sally Musa, and I'm so pleased to be joined by three leading health experts from the esteemed Fakeeh University Hospital: Dr. Ahmed Hassoun, clinical professor and consultant endocrinologist; Dr. Khaldoon Taha, consultant cardiologist, as well as clinical dietitian Reshma Devjani. Fakeeh University Hospital is built on an integrated healthcare model, bringing you the legacy of over 4 decades of compassionate care drawn from the renowned Fakeeh Care Group based in Saudi Arabia. It is also a world-class academic center committed to excellence through research, education, and clinical care. Located in Dubai Silicon Oasis, Fakeeh University Hospital is a 350-bed state-of-the-art facility providing primary, secondary, and tertiary care. It is, of course, equipped with cutting-edge technology and smart systems, so you know you are in very good hands. Now, welcome to all of our speakers today. And Dr. Ahmed, I would love to start with you. Fasting is, of course, an ancient practice that is common across many faiths and religions, and it is known to have many health as well as spiritual benefits. And intermittent fasting is something that people are also now practicing for general health, not just in Ramadan. But if there are medical conditions, this, of course, presents new challenges. So what are some of the most common medical conditions that require that extra care and attention when it comes to fasting Ramadan?
First, good morning, Sally, and good morning for our team from Fakeeh University. And I'm also like to, say Ramadan Mubarak for the people who are hearing us, and for you, everybody who is going to fast with us here. And just to answer your question, it is very important to remember the most common diseases that will be really related and affected by Ramadan are, my specialty is probably number one is diabetes is number one. And also my colleague, Dr. Khaldoon, cardiovascular disease, cerebrovascular disease, which is a vascular disease as well. Importantly, as you mentioned in your introduction, also is the renal impaired people and some other diseases affected in a way or another. For example, thyroid disease might be affected by the timing of taking the medication. They will have some issues of taking it in a different time during fasting Ramadan. Can't hear you.
Yes, definitely. Diabetes is one of the biggest issues that comes up when we are talking about fasting the month of Ramadan, and we're going to get to that. But I wanted to come to you, Dr. Khaldoon, and in terms of you as a consultant cardiologist, what is your advice and what kind of cardiac patients are we looking at here that do need to take extra care when they are looking at fasting the holy month?
Thanks, Sally. Glad to be here. Thank you for the invitation. Actually, in general, if we look at the cardiac patient, the study showed that probably 85% of the population will be able to fast. That means there is a 15% they will not be able to fast. Of course, is when we talk about a special condition, we're talking about patient who has uncontrolled blood pressure, patient who is recently coming out of surgeries. And in general, if we want to generalize it, we say that patient who has symptoms at rest or with minimal activities, probably it's better off not to fast after consulting with his physician. But it's all boiled down to a discussion with the candid discussion with the patient and his physicians. There is a precautionary measures, especially on the timing of the medication, especially patient who's taking diuretics, or we call it water pill. Those patients should take extra caution in terms of the timing of the medication and the amount of fluid they're taking.
Very, very important. And hydration is one of the most important things to remember here in Ramadan. Reshma, I'd love to come to you now. Dr. Khaldoon and Dr. Ahmed, they've given us a pretty fair idea about who should be careful about fasting Ramadan. But from your perspective as a dietitian, who else needs to be really careful about this?
Okay, so Ramadan fasting has some benefits as well as some side effects. So I would first talk about the benefits. Benefits would include, losing weight, an improvement in the lipid profile of the patients if they are eating healthy fats, and improvement in the blood pressure of the patient. So there are some benefits that the patient might experience. Now, when coming to the side effects, especially patients with diabetes might end up having episodes of hyperglycemia or low blood sugar levels. It might result in dehydration, mood swings. So there can be also some of the negative side effects from the fasting.
That is really important to keep in mind too. Now, before we do keep going, I'm going to mention a couple of things for our audience who have joined us today. Hello and welcome to you all. If you do want to ask our experts a question, it's very simple. At the bottom of your screen, there is the questions tab. Just click on that and type your questions in there, and we will make sure that we do our best to get it to our speakers as well. And if of course you want more information on the panelists or on Fakeeh University Hospital, you can click on the links to the top left of your screen that say speakers and booths. And when you right click on that, you can open it in a new tab so that you can make sure that you have the webinar also going as well at the same time, so that you can check out that information, but also keep watching and keep listening. And finally, what we're doing today is we're going to be having a couple of polls running. So the first poll question is up. It has just gone live, which is very exciting. Okay, this is for people with medical conditions. Do you consult your doctor before fasting? And to participate in that, just click on polls at the bottom of the screen. I can see lots of people already jumping in to vote there. Yes. So we want to see what everybody does here and, see everyone's views and how they approach fasting. So make sure you participate in the poll. I can see the numbers jumping up and down, and we will get our doctors' opinions on this too. But coming back to you, Dr. Ahmed, as you said, diabetes is one of the most common health conditions. So how do you know when you're a diabetic patient, how do you know if you can fast Ramadan or not?
This is very important. And again, the poll they put is a very good one, basically, to see how they are doing. It is very important for anyone with health issues, chronic health issues. Mainly, let's talk about especially the diabetes one here. It's very important to know the level of the control of the blood glucose, if they have any issues, any problems, any hypoglycemia. And that should be done by consulting with their physician before going, to Ramadan fasting. And when they go to see their physician, and it will be really recommended that should be done earlier, like 6 weeks. Still, we have time to give some help, but it would be always better to do it like 4 to 6 weeks before, because they will need, and especially I'm talking about diabetes now, they will need education. And that is very much important in recommending some education regarding fasting Ramadan, what they have to do, if there are medication to be adjusted, medication to be changed sometimes, reducing the dose, changing the timing of the medication, especially we have the fasting time and suhoor and iftar. So all these are very important. And more importantly, the doctor will decide by evaluating the condition that how risk they are having. Are they having a higher risk, lower risk, or what we call moderate risk? So it's very important for them to go and check with their physician before Ramadan fasting. And I think even if they didn't do it yet, it's worth going and checking at least to get some benefit if they are fasting, specifically if they are fasting.
That they are coming well beforehand, that this care needs to be followed up and taken well ahead of time, as well, as you say. Dr. Khaldoon, when we're talking about what precautions did they really need to take before fasting?
Well, again, after discussion with the physicians or a trusted physician, I would say the most important things is to stick to their medication. The timing of the medication and the what you alluded to, the fluid and salt intake. Patient, especially who is in diuretics. So we don't want to overdo it with salt. We want to take the proper hydrations. But the most question we're asked by the patient is, what time should I take my medicine? How do I take it? And we try just to work it out with the patient who we feel that he is fit to fast, that we can work the schedule of medication.
I would love for you to talk a little bit more about, the importance of hydration. And I know Reshma will have a lot to say about this too, because, a lot of us forget to properly hydrate, and we tend to, really go to the juices rather than water. But Dr. Khaldoon, in terms of hydration, what are your recommendations to make sure that particularly cardiac patients are remaining properly hydrated?
Well, that's a very good and important really question, not only for the heart patient, in general population. I mean, especially when the Ramadan comes with the hot weather, and we tend to try to get zealous and exercise before the breaking fast. I think is the proper intake of fluid, but not to be taking it on one shot over the span of the non-fasting hours is important. In general, we recommend that the patient or the normal person will take approximately 1.5 to 2 liters, unless they are in a certain jobs where they excessively sweat or they lose really fluid in the outside sun. But the amount of fluid which we recommend is 1.5 to 2 liters, give and take. It depends on the patient. Now, patient who is in diuretics, keep in mind that we don't recommend that they take their diuretics in the early morning hours at Fajr. We recommend that they take it after breaking their fast, because that they can compensate for the fluid intake.
That is really important. The timing of the medication that is being taken as well. And I can see you nodding there, Dr. Ahmed. In terms of medication, is that the best time to take medication after breaking the fast, rather than, because some people think I need the impact of the medication during the day. Is it better to take it after breaking the fast?
Well, that's a good question. And again, it depends on the individual and the disease. So Dr. Khaldoon, my colleague, talking about more of the patients probably with the heart disease. In diabetes, it's a little bit different. As you know, as you mentioned earlier, you might have a need to control the sugar even during fasting, because you don't want to use the fasting in Ramadan just to worsen your blood glucose control. No, you need to continue doing that. And that's the importance of discussing this with their physician to see what can they do. They might need to adjust the medication, as Dr. Khaldoon mentioned, especially also for diabetes, reducing the dose maybe in the suhoor time, but they might still need to take some medication. And again, it's on an individual base, depends on the case, and depends on the condition, and depends on the medication. Some medication has to be given, I'm talking now for diabetes specifically, has to be given in the suhoor time as well as iftar. But the important point of what Dr. Khaldoon said, usually most of the medication will be shifted to the iftar time. But in diabetes, we still have some medication that should be continuing in a modified dose in suhoor time.
Just I want to comment
Yes.
something, Ali, just not to be misunderstood. Not all the medication, I'm talking about diuretics specifically. Of course, we
Very
like
important. Yes.
to be taken on a proper timing, proper spacing, and usually between iftar and sahur, and sometimes we take medication in the middle, but I'm talking about diuretics per se. We want it to be after iftar.
Amazing. So Reshma, if we can come to you now, there is, of course, so much to talk about when it comes to what we eat, not just every day, but particularly in the month of Ramadan, because this is really crucial when you have such a limited window of time when you can actually consume food and drink. And sometimes it's such a short period, just a few hours. And because of that, we often get seduced by large
I'm sorry, Sally, your voice is cracking. I can't hear your question. Sally, I'm unable to hear you. Your voice was cracking. Could you please repeat the question?
No problem with the connection. This is Mark Zuckerberg is working against us.
Hello?
We lost Sally.
Yeah, we lost Sally, yes. I couldn't hear her question.
Should we discuss ourselves then?
I think probably I should talk about the iftar meal and the suhoor meal.
Maybe, I don't know, maybe it's a good idea. And
Let's wait for Sally to join in, and in the meanwhile, I'll continue. So, iftar meal, when it comes to iftar, it's very important that patients, they break their fast, especially diabetics or patients with chronic conditions. They break their fast with 1 to 3 dates. If they are aiming to lose weight, like not to have a lot of calories from, empty calories from the dates. And then it's very important that hydration should be followed as soon as they open the fast. So they can have options like having laban, soups, a lot of water, or any other low-calorie drinks. But it's very important to emphasize here that fast should not be opened with a lot of sugar-loaded beverages. And probably after that, when we open the fast, it's very important that it should be followed by a soup and a salad to control the immediate hunger, because it's been like a long hours of fasting, and when it's by the time it's the time to open the fast, already people who are fasting are too much hungry, and then what happens is they end up eating excessive intake of carbs, or end up eating a lot of sugar, unhealthy or fried snacks. So it's very important that always the fast should be opened with low-calorie food. So emphasis should go on fluids and fiber before they start with the main course. Okay. Sally, are you back?
Well, also let me mention something while we are waiting for Sally. Sally is back.
Yeah.
Yes. No, we've taken care of some technical issues that we were having, but that's exactly right. This is exactly what I was asking about in terms of, when we get to finally, we have fasted that entire day and there's such a small time period to eat, we get overexcited, Reshma, don't we?
Yes,
and we just go crazy, with all of the food that's in front of us and the sweets and everything. And we tend to, as you said, we tend to go for those salty, fatty, sugary things, right? That's what gets us excited. But, I think you gave us quite a good, little rundown there of the kind of things that we do need to start. We do need our vegetables, our salads. The funny thing is, a lot of us know this stuff, and it's not really different from different patients, is it? But we don't really do it.
Right.
the Ramadan meal should not be different. Like it should be ideally similar to what you've been following before fasting. It should not be something that should be an unhealthy, it should not turn into an unhealthy thing. That's very important.
Yes, exactly. Don't suddenly change everything. And, because we've been talking a lot about hydration, people go for the juices a lot. And so that high sugar content is, straight up from the minute that they break the fast. I would love for you to address that, and I'll come to you as well after that, Dr. Ahmed. But in terms of sugar is actually really important. And there's a reason why we break our fast with dates rather than juices. So can you speak a little bit more to that? There is so much wisdom in this.
Yeah, I mean, dates are not only dates are not only providing you just sugar. They're giving you energy. Yes, they're giving you electrolytes, especially potassium. It's also giving you fiber. So it's not like just an empty calorie food unless it's eaten in a big amount. Okay, whereas if it comes to juicing or having, sugar-loaded beverages, you're ending up only eating calories. There's no other benefit. You don't get any other nutrients. So it's calorie-dense, stuff that you should avoid completely. Plus, for diabetics, especially for patients who have pre-diabetes or diabetics or overweight patients, they end up eating too much calories plus slow-acting, like fast-acting carbs, which increases the sugar rapidly for the diabetics. So it's very important to avoid sugar-loaded or refined carbs when they are opening their fast.
So important. Dr. Ahmed, if I can get you to comment on that, the beautiful, beautiful dua that we say when we eat the dates, when we break our fast, ذهب الظمأ وابتلت العروق. Like it tells you exactly what's going on in your body, that, your hunger is gone, and then suddenly you will get that amazing rush of nutrients into your body that only dates can safely give, right?
Right. Yeah. I mean, it's very important. And this is part of the sunnah is recommended to have the dates. And it is really, as mentioned by Rishma, that's the benefit of date. It's not only sugar, it has other things in it, very healthy things to add. And again, somebody is fasting, he have already changes in the hormones, including insulin being on the lower level. And when they eat, starting to have the insulin secreted to go into the more of using the calories with the help of our hormones. And I think it is very good that we start with a date, and we will feel much better to start this. And I think Rishma will talk more about in details later if you have questions about the other food after that. People are snacking, and maybe we'll come to that later on. But it is very important to have these dates, but not as some people do, take 7 days or 9 days, taking the singular number, but in a higher number. So we need to be careful and use it as the case indicated by our dietitian, as Rashma, for example, might advise the people to take 1 or 3 if we're talking about singular number.
Yes, exactly, because that's part of the sunnah as well, to take, it's either 1 or 3. 3 is a, good maximum number. It's kind of interesting to think about that. Is that so? Dates, and they're a great source of sugar, very healthy sugar. Is that good for diabetics as well, to break their fast with dates too?
For me, I can answer that, and maybe Rishma can comment. Yes, sure, they can. But again, the difference would be, as I mentioned, I said 1 or 3 rather than 7. I'm talking really about diabetics, because people who are diabetics, they probably can take 5, 7. Khaldun, his patient might need more. They can give him more, but they don't have any issues with the sugar, so there's no problem there. Normal people can take more. But again, if we're thinking about the whole benefit of this, too much of anything is not good, because, for example, at the end, if somebody is healthy and going to take too many dates and too many calories, he will have obesity and having to have the risk, again, in my specialty, to develop pre-diabetes or even diabetes.
It's very interesting that you talk about that, the pre-diabetes, because a lot of people go undiagnosed, and some estimates give us 40% of people actually have diabetes and they don't even know it. So, how important is it for people, not just diabetics, to get their blood sugar checked before starting to fast?
Right. That's a very good question, Sally, because it's probably a chance now, since they're going to have the fasting, It's always good to know your sugar even before fasting. But since now fasting Ramadan is coming soon, and you want to know where are you? Are you diabetic, pre-diabetic, or you are healthy otherwise? It's good to have your sugar checked, and it's time to do that. And the importance of that, not only to know where you are if you are diabetic, but as we said earlier, could be pre-diabetes. And that is again important because people with diabetes or pre-diabetes earlier diagnosed will have the complications might be already there early, and you can prevent them from getting worse, or even sometimes if they are early, you can reverse them even before diabetes. So people with pre-diabetes might have this complication as well as an early as pre-diabetes stage.
Very, very interesting there. Dr. Khaldoon, if I can ask you, in terms of cardiac patients, and some studies actually show that it's beneficial for heart patients to fast. So what are the benefits here? Dr. Khaldoon.
He's muted.
Yes.
Well, sorry, but as most of you know, that lifestyle, habit, and behavior play a major role, not only the development, but the progression and the exacerbation of heart disease. We're talking about calorie intake, salt intake, smoking, physical activities. So when we talk about fasting, of course, studies showed that patients who's fasted, most of them improved in their vascular risk. There is something we call the Framingham risk score, which is looking at 10-year risk. And the study showed that by the end of Ramadan, there is an improvement in the vascular risk. Other studies showed that we have the good and the bad cholesterol. We have the LDL, the lousy cholesterol, and the H, the happy cholesterol. And most of the data showed that the happy cholesterol goes up with fasting and the lousy cholesterol goes down. There is a small study showed that there is something called the endothelium, which is the inner lining of the vessels. And usually it secretes some substance called the nitric oxide, which is very important for the health of the vessels. This small study showed that the nitric oxide goes up with fasting. So overall, fasting in the proper way and the not to overdo it after breaking fast, it will really definitely, it will be a startup for a journey of going back to the healthy lifestyle. Unfortunately, the weight is, most of the studies showed that weight might come down, but unfortunately, the study showed that weight flip back again after Ramadan. So I think this is the adjusting the lifestyle, which will be for in terms of weight, the calorie, the salt, and the smoking. It is important to be a starting point for the journey of healthy lifestyle.
Because this is what Ramadan is about, isn't it? It's about resetting our patterns and hopefully becoming healthier. It's not supposed to be just for the month of Ramadan. Hopefully we're supposed to carry those habits later on. And, 30 days is a good time, isn't it, Reshma, when we're talking about hopefully getting someone to get into a new routine of being, able to eat better and to adopt healthier habits as well.
Yeah, definitely. Yes. It's very important that the discipline that comes with Ramadan is continued after the Ramadan. So
yes.
It's important that, if you have any new resolutions on, adding on activity that you were doing during Ramadan, it should be continued. And if there's any modifications that you have brought into your eating habits, should be continued after Ramadan. So indeed, Ramadan, it's a good, window to modify the lifestyle altogether.
So what kind of meals make for healthier Ramadan meals? I know we love sambusa, right?
Yes.
We love the sweets. We love the gatayif. I know there's lots of people listening out there going, I can't wait for the gatayif to come around. But, from your perspective, if you were going to be able to design a healthy Ramadan meals, particularly for those who do have diabetes or other conditions, what would that look like?
Firstly, there are no good or bad foods. It's the portions that you are taking that makes it good or bad. If you are not active, that makes your, that you're eating, you want to have pleasure. Yes. If you're not burning it out, then that makes it bad. Yes. But when it comes to choosing a healthy meal, I always advocate the plate method to my patients. So if we have a 9-inch across plate, a standard dinner plate, a quarter of the plate should be whole grain. So like it could be brown rice, quinoa, it could be 2 slices of whole grain bread. Other quarter, roughly 3 to 4 ounces of lean meat, or it could be fish, a cup of beans or lentils, and half the plate should be salad. This meal can be accompanied with a serving of low-fat yogurt or laban and a serving of fruit, which could be 100 to 120 gram portion of a fruit. So that gives all the elements are there on this plate, and it's easy for the patient at the same time. When you advocate this method, it's easy for the patients to follow because they do not have to go by, measurements and portioning of the meals. It's easy when you teach them by the plate method. And I believe this is the ideal thing that they should be doing when they are portioning out their Ramadan meals. This is the way they should be portioning it out.
Absolutely. And make sure, as Dr. Khaldoon was saying, hydration is vital, making sure you drink enough water. 1.5 to 2 liters is a good amount. But also, again, to his point, not to drink it all at once.
Exactly. And then it's very important that because Ramadan falls in different weather conditions based on the calendar. So it's very important when it falls into summer months, the hydration has to be improved. It can go up to 2.5 to 3 liters also if you are indulging into an exercise routine, so it's very important that hydration has to be emphasized along with the food that the patient is you're taking. And then it's very important that, yes, abstinence, avoiding alcohol, smoking is very, is also adding the benefit to the lifestyle, so it's very important that this is continued after, post-Ramadan, and that, to sustain the weight loss, to sustain the benefits that you have received during Ramadan.
Absolutely. Now, let's take a look at the results of the first poll. And the question was, do you consult your doctor before deciding to fast? And 64% of people said yes, that they do talk to their doctor before they fast. Dr. Ahmed, if you do have a health condition, how critical is it actually to get the go-ahead from your doctor before you do start fasting?
Well, I think if it's a health condition, again, importantly to check with your physician and get evaluated. And as I said earlier, should be as early as you can, 4 to 6 weeks may be good. And the doctor will look into many aspects of your health. For example, I'm talking now again in diabetes. Do you have diabetes type 1? Do you have, type 2? All this make a difference. If you have a treatment with insulin or sulfonylurea or other medication, all make a difference. So all this will be taken in consideration. How old are you? Do you have any other complications? Heart disease. Some of the heart disease might have some limitations, such as heart failure, for example. Dr. Khaldoon, my friend, might comment on that as well. But really important part is the kidney. Chronic kidney disease is a very important thing to keep in mind. So the doctor will look into all this, will come with a risk calculation, and thanks to the International Diabetes Federation, they have came with just recently in 2021 with the new guidelines regarding fasting in Ramadan. And many of my colleagues in the world, actually, the Muslim world, they were acting into these guidelines under the leadership of another colleague of mine, Dr. Mohammed Hassanin. We have to mention that for his efforts, and came with a very, very nice, guidelines. And I would encourage people our physicians, doctors dealing with this, they can look into that as well. And that is regarding diabetes. So all this would be taken into consideration. They will have risk calculation, and there is a new risk calculator for that purposes. Depending on the score they get, if the score is high, considered high risk, or if it is low, it's low risk, and if it's moderate risk. So it's very important for the patient to go and see his physician to give him the go-ahead, or give him some instruction whether give him the choice of he can or he cannot. But sometimes there is a rule, you should not be fasting, and there is a rule that you should be fasting. And in the middle, here is the benefit of discussing with the physician about where am I. And again, sometimes the patient will insist on fasting. So if he's not supposed to fast and insist on fasting, then it's very important the physician will discuss, okay, we don't recommend you fast, but if you fast, you need to be careful, do 1, 2, 3, 4 medications. Very importantly, glucose monitoring, checking the sugars frequently.
Excellent. Very important there. Very important advice. And Dr. Khaldoun, for you, when we are looking at patients, heart patients, what do they need to think about before they make the decision to fast as well?
Well, rule number one is basically not to challenge yourself, not to say, let me fast a few days and then I'll find out, and if I don't feel good, because we are not really trying to test you. I think is prior to making this decision, discussing with the physicians about the risk of fasting, about the medication adjustment, about the timing of the dedication. I think this is the most important steps you take, because as I mentioned earlier, there is a 15% of the heart patients cannot fast, and they should not fast, and they have the permission not to fast. So I think it's the simple question to the physician: is it risky? Should I fast? And when should I take my medication? This is a very, very simple question, and then you make up your mind. But I don't think we should take the initiative as a patient and just to try to challenge myself. And if I could not, or if I could not make it, then I will ask my physicians. It's a very easy to discuss it with the physician, even over the phone. Is what do you think? How do I adjust my medicine? Is it risky? Somebody with a very high blood pressure and is not controlled, we don't think that he should fast, because that makes things worse. And that is very important to know. So I think it's a discussion with a trusted physician is very important.
Absolutely, definitely. Make sure you do talk to your doctor about it. And I'm just going to come back to the polls, because we have a second question for everybody to answer. And again, this is for those who do have medical conditions. Do you end up overeating during Ramadan? Actually, just for everyone, I'm going to put my hand up. Yes, I overeat during Ramadan, 100%. But something that I do notice is that, after fasting a few days, you kind of naturally bring down your food intake simply because you're fasting, and simply because you are, making sure that you don't go overboard, and because, it's just, it doesn't end well, as we know, Reshma, isn't that right? How important is that to actually look at that and, not just what we eat, but how we eat it as well?
That's very important. That's a good one. Actually, yes, it's very important to make sure when someone is fasting, it's very important that they pay attention to the pace of eating. When they tend to eat up very fast, they tend to eat up more calories, because the satiety signal takes at least 20 to 30 minutes to reach your brain. And by the time the signal is already overeaten. So that's very important. And this was the reason I emphasized earlier that it's very important that when you open up the fast, you start up with low calorie foods. Fill up on fluids, fill up on salads before you start with your main meal.
Yes, exactly. Very important. But
even if you're eating faster, you are eating on low calorie foods. You're not filling up on calorie dense foods.
Yes. And something that I find that really helps in that way as well is to make sure that you have your date and, your water, or like I tend to drink yogurt. Yes. And then to actually get up and pray, and then come back and have the rest of the food, because kind of breaking that kind of breaks the hunger, that
immediate hunger after fasting.
Yeah.
Yes.
So then you kind of come back with within your mind, you're not eating out of your mind, and just kind of going crazy eating the food because you're so hungry. It just kind of calms everything down. You go to pray. And, I guess that's part of mindfulness, isn't it? That kind of mindful eating that we've been hearing a lot about as well is really important, isn't it?
Of course, for sure. Yes. It's about, as I said, it's about portion control. Watch what you are eating. Is the food that you're eating is a calorie dense one? So all of these factors, they matter.
Yes.
And also when it comes to especially patients who have disease conditions like diabetes, it's very important that eating too much carb at one meal could result in excessive, high blood sugar readings after the meal. And this might result in a mismanagement of diabetes.
Right. And
That's another big one.
It's better to spread the carbs over, the non-fasting hours evenly rather than to have too much carb on one particular meal.
Right. I can see you, Dr. Ahmed, wanting to add to this, please.
Yes, just a comment. You mentioned about the mindset about eating the dates and this. This is true, but it's not only mindset. It's really physiologically, because when you're eating that, there is hormonal changes that will support that you feel a little bit more, satiety than, if you are not eating this. So it is also mindset, but also hormonally, there's some changes in hormones in our body. Just to add that. Thank you.
I love that. Very important. And just, can you add a little bit more about the carbs? We hear so much about carbs, and some people are just cutting them out completely out of their diet. But, what are your thoughts on carbohydrates? How should we be eating them? And of course, not all carbohydrates are the same.
Yes, exactly. So when it comes to choosing carbohydrates, it's very important that, it's very important to choose the complex carbs. So when we say complex, something with more fiber. So the reason why we say that is because the body will take a longer time to digest and absorb that kind of carb, and it will last long the energy levels throughout during the non-fasting hours. It's very important to choose complex carbs like from whole grains, beans, lentils, fruits. So this is something more better compared to having sugar-loaded beverages or desserts during the non-fasting hours.
Excellent. And Dr. Ahmed, in terms of positives on things like diabetes and even polycystic ovarian syndrome, the positives of fasting, what do you see there?
Well, that's a good question as well, Sally. As always, your questions are excellent questions selected. Basically, for diabetes and polycystic ovary, but mainly let's talk about diabetes now. As mentioned earlier, that will help in improving the glucose control. The sugar control will improve supposed to when you are fasting. But the problem is after fasting, if your iftar is not following what my friend Rishma advised in a good way, in a calorie-wise, carbohydrate-wise, then they will ruin all the benefits of during the fasting time. Not only that, also for the issue of now polycystic and diabetes, we have beneficial effect on insulin sensitivity. So we know in polycystic ovary, we have insulin resistance. That's one of the theory about the disease. And that will improve with fasting, even before losing weight. Fasting by itself will improve insulin sensitivity. There is a lot of, again, my friend Dr. Khaldoon mentioned the lipids. Yes, the lipids profile will be more of a positive one. And some studies showing even triglyceride goes down, and HDL cholesterol, which is the good cholesterol, goes up, as mentioned by colleague Dr. Khaldoon. There are other positive things in something, recently been looked at is the gut microbiota. Our body having, bacteria in our intestine. And this has been a lot of studies now going on in the field showing that intermittent fasting as well in Ramadan fasting, you will have positive changes in this microbiota in our intestine, very beneficial in a way that it will help into the improving, again, the content of this bacteria to be more of a helpful than harmful one. And they are involved in many other things. In addition to that, there are changes happening in intermittent fasting as well as in fasting Ramadan with regard of genetic, some modification on their action. There is improvement in antioxidative stress happening in the genes that are involved in that. And there is basically a protection against this. And again, there is some other issues with the genetics regarding of anti-aging, so we start to be younger, hopefully, with continuing doing the right thing. But again, very important to do the fasting in the right way as we were supposed to do it. Fasting for benefit, not for celebration after iftar and ruining all the good things we do during the fasting time.
Yes, let's hope that we can maintain that, because that's really important. I can see lots of people sending in questions. Let's start getting to those questions, and don't forget the poll as well. Do you tend to overeat when you break your fast in Ramadan? I can tell you Right now it's split 50-50. Let's see in a few minutes how many people will admit to saying yes.
Yeah.
Okay, let's go to our first question. How do we control uncontrolled blood pressure during Ramadan? That is from Nusrat. And if I can direct that question to you, Dr. Khaldoon.
Well, pressure has to be controlled before Ramadan. I mean, it's not easy to control the blood pressure during Ramadan hours. The blood pressure has to be controlled before Ramadan. And if it's continued to be uncontrolled, then there might be a cause of holding on fasting because it's during Ramadan is the timing of the medication, the timing of sleeping hours. It's changed a little bit. So it's difficult for us to make the control during Ramadan and fasting. So it's better off to be controlling the blood pressure before Ramadan and before going into the fasting month. One point which I want to make, Sadi, about the Ramadan is the usually the gathering month, the family invitation, the eating out. And we tend to forget about the salt intake. Usually people get to their salt intake restricted at home, but with all this gathering, they come with the excuse, doctor, I didn't know, I went to those, I this, and we end up with a fluid retention or uncontrolled blood pressure. So this is a point which we have to be very careful with all this invitation and eating out, that our salt intake continue to be restricted, not an excuse to end up with a problem in terms of fluid retention or high blood pressure.
I have something to add.
Yes.
It's very important that during the non-fasting hours, when you're choosing to have, you need to minimize the salt because that will make you more thirsty during the fasting hours. Again, that's one of the reasons that's besides the benefit for from the cardiovascular perspective. Also, when it comes to hydration and feeling thirsty, when you take a lot of salt in your diet, it will make you more thirsty. And during the fasting hours, it's very important that they should take care of, people should take care when they're fasting to restrict their sodium intake.
Very, very good advice. Thank you so much for that, Reshma. And Dr.
Cannot hear you.
We lost her. No, I think we lost her. I think.
Dr. Ahmed, if we can direct this question to you, when is the best time to take thyroid medicine during Ramadan?
Well, again, it's always advised that thyroid medication to be given 30 minutes before meal. So if you're able to do it before suhoor, you're not eating, before the suhoor time, for a while, and then you take it, half an hour before your suhoor, that would be reasonable. Sometimes we recommend to be given at bedtime, again, having an idea that you don't have food mixed with it because it's very sensitive to be mixed with food and the absorption will be reduced.
Okay. All right. I think we have covered polycystic ovarian syndrome. Rosona had sent in that question, and I think you covered it briefly, Dr. Ahmed. Yes.
Yes, in the benefit we talked about, that insulin sensitizing, would be happening in Ramadan in fasting, and that would be a beneficial effect on that. But again, polycystic ovary is other issues that you need to address it with your physician, or a gynecologist or endocrinologist will be the one looking into the other medication taken by the person, and that would be, for example, needs modification or the timing. Just for example, glucophage might be given sometimes for people with polycystic ovary. In that regard, again, they have to modify the timing for suhoor and iftar, depends on how many tablets the patient is taking. So if they are taking, for example, if you wanted to expand on that, if they are taking the type of glucophage XR, extended release, they can take it again in the iftar time. Whether it's one tablet or two tablets can be given together at iftar time. If they are not taking the XR and they are taking two tablets, they still can take it on, for example, in the suhoor time and also in the iftar time.
Yes. Okay. Shashir had asked about a specific diet for Ramadan to control blood pressure, and I think we covered it in talking about the salt. It's very important to restrict your salt intake. Is there anything that Reshma you wanted to add about that? I think it's
physical activity.
Yeah.
I think we didn't talk about physical activity. So when comes to physical activity during the fasting, it's always important that physical activity should be added after opening, like after the iftar meal. It should not be done during the fasting hours because of risks of dehydration and fatigue, lethargy. So it's very important if anyone aims to add physical activity, it should be only after, like during the non-fasting hours.
Okay, very good. Some people I see they try to exercise just in the very last hour before, when they're fasting, before they break their fast. Would you recommend that, or would you still say it's the best to exercise when you're not fasting?
I wouldn't advise that, especially in UAE. The weather is hot, and if you're exercising while you're not hydrated, it might risk, it might put someone at risk of, dizziness, or because the blood pressure might drop, and someone might collapse, or so that's not advisable because of that reason. So it's always better to exercise only after you have had something, you've hydrated enough, only after that.
We have another question here. I have tuberculosis in the spine and I'm taking dots. Can I fast during my treatment? This is from Muhammad. Dr. Ahmed, I wonder if you can comment on that one.
I would rather not to comment on that.
Okay.
I would suggest that he will discuss with his physician who's taking care of him.
That's more detailed. It requires a more detailed consultation. Okay, got it. Okay. This is a good question. What about diabetic pregnant women fasting during Ramadan? This is from Jasira.
Right. Well, basically, pregnancy in diabetes, we recommend not to fast. But again, some people still would like to fast. And it is, if they insisted on fasting against the advice, they need to be very careful about what medication they are taking. For example, if they are taking insulin, it's very difficult and they should really not even to think about fasting. But some people, for example, are not taking any medication, just diet control or this. Again, we don't recommend fasting, but if they fast, they are in a safer way than the other people. Or if they are taking, for example, some people take a glucophage, and again, it is safer because it does not cause hypoglycemia, low sugars. And in a way, still my recommendation, pregnant lady with diabetes should not fast. That's the main thing.
And of course, as we know, women who are pregnant, women who are breastfeeding, there is that, there's leeway for them as well not to fast, just like somebody who is ill. You don't have to fast, but I think we sometimes feel a little bit of the pressure and we feel like, oh, we want to do it with everybody, but there's nothing wrong with not fast. Like you actually, you have permission to not fast, so it's fine. It's okay. Okay. This is a really good question from Nada. As a diabetic, what type of food should I eat during suhoor to give me maximum energy? Reshma.
Again, if we come to that, again, it's very important choosing slow digesting carbs or complex carbs, having adequate protein in the diet from eggs or beans, and having adequate hydration before before going into the fasting period again. So it's very important to go with slow digesting carbs or complex carbs, and to have it close to the fasting, as close as much possible, close to the fasting, so that the energy lasts longer, and so you don't feel lethargy or fatigue.
And if I add something, Reshma, I really prefer also the people to take healthy fats. We talk about
healthy fats, exactly. Yes, that's right. Yeah.
Nuts, because they make them more, feeling full, especially in the first few hours.
That's right. Thanks for adding that. Yes.
Yeah. Thank you.
Yes.
So that's really, yes. Sorry, go ahead. In terms of healthy fat, what are we talking about here? I think some people may get confused between different kinds of fats and not really know what's considered a healthy fat and what's not.
So fats from sources like nuts, avocado, fish, the oily fish, especially like salmon, sardines, or healthy oils like olive oil, canola oil. This is the kind of fats that should be added, contrary to adding cream, butter, or any other form of, unhealthy fats, especially from outside food, that should be avoided.
Yes, I think olive oil features quite a bit in Middle Eastern food quite well. Yes. Avocados are fantastic, and it's almost a meal in and of itself, if you make yourself some guacamole and
also makes some calories, so we cannot overdo.
Yes, that's important. So in terms of, because, in terms of proteins, we're told that it's a good idea to have quite a bit of protein as well, because that will keep you full and satiated and keep away the carbs and the cravings for the carbs too. So what would be healthy in terms of proteins there?
Okay, so when it comes to proteins, beans, lentils, nuts, besides giving you fast, they're also giving you some protein, so you can add those in between when you're snacking during the non-fasting hours. Adding fish, which is again heart healthy, especially the oily fish like salmon, sardines, herring, mackerel, trout. This is the oily fish that should be added preferably. When it comes to choosing the white meat, the poultry, it should go without skin. And if you're choosing the red meat, the leaner cuts are to be chosen compared to the fatty cuts. Avoid the processed meat like hot dogs, salami, sausages, or any other kind of processed meat. They are loaded with sodium and unhealthy fats, so they need to be avoided.
Very, very good. This one, Dr. Ahmed, if you can comment on this. Somebody asking, should I keep checking my blood sugar during Ramadan? How often should somebody keep checking their blood sugar?
That's a good question. Actually, it's not only during Ramadan. It should be always to check, especially it depends on what you're taking medication. For example, any medication causes hypoglycemia, they always should be checking Ramadan or before Ramadan. Now in Ramadan, it's becoming more important to check it because of the fasting and the potential of having problem with fasting, whether it is hypoglycemia, low sugars, or hyperglycemia, high sugars as well, both. So we recommend, especially in the first few days, to do sometimes we say 7 points of checking. And I can tell you when we do that. And again, it's an individual base. It depends on the case, depends on the medication. Some people will do much less than that, but it will be recommended to check at least 3 to 4 times. But the times that we recommend, for example, starting from the morning, before suhoor, in the morning after waking up, seeing the effect of suhoor and the medication you're taking. At noontime, I'm giving you all of them now, but again, the patient will be individualized on what depends on the case. Let's say Salat al-Dhuhr, Dhuhr time, noontime, afternoon time, just before breaking the fast, after they iftar and they have problem, hopefully not, and eating too much of carbs and so their carb is getting them into high sugars after iftar. These are the main times, and again, it's an individual base. Some of them need less, some of them need more. But if they have any drug that causes them to have hypoglycemia specifically, because that's more dangerous, in the beginning, in the few days, then they have to check more frequently in the first 2-3 days to find where they are. And also, again, this has to be discussed beforehand with their doctors before going into that.
Very important. Okay. Just in terms of our poll, do you end up overeating during Ramadan? 60% of people said no, which kind of, I have to be honest, does that surprise you, Dr. Ahmed and Reshma and Dr. Khaldoon?
Yes.
Well, it's an audience, by the way. Educated.
Actually, that's the study showed. I mean, it's a mixed result, but the overall result showed that probably a loss of 1 to 2 kilos by the end of the month. But it's a mix, depends on the region, depends on the areas and the preference. But overall, I think there is some weight loss if we don't overdo it and beat the main objective of Ramadan.
I add, Sally, about this that looking at our patients, for example, my patients, I will see both. Some of them come to Ramadan to increase weight, some of them come reducing weight. If you ask me, I'm not diabetic, but I lose weight usually in Ramadan, which is good. I'm happy to have
Very good. Very good. Very good.
Same with me. I do see patients who have gained weight and we will come to you for losing weight after Ramadan.
Just very quickly, before we wrap up, because we are running out of time very quickly, just in terms of caffeine and how that might affect, blood pressure or cardiac issues, is that a concern? I know you love your caffeine, your coffee, Dr. Ahmed. Is this something that your patients need to be mindful of?
Well, again, the Ramadan issue is the timing of this, and people who take a lot of caffeine, they might have the headaches if they not take the caffeine, especially in the first few days. And they have to be careful. So what I told you before we started the meeting, that I would try to taper my caffeine drink for a few days starting from ago, and actually diluting the coffee during the time of the daytime. But after iftar, they can take their coffee for sure. So caffeine is good. Actually, there is many beneficial effects for caffeine, and just to take in moderation is always good to have. But again, the issue of really having the headaches for the people who are using a lot of caffeine before Ramadan, they might have to face some issues of headaches in the first few days. So they need to be careful, and I would suggest that they start tapering this before Ramadan. We have a few days remaining. Maybe they can do like what I'm doing, cutting down on the caffeine and the tea, the coffee and the tea as well, and moving them actually now to the more of the evening time, like simulating as Ramadan coming.
This is it. Exactly. Take advantage right now. And, as we conclude the webinar, we have to really emphasize that, our amazing guests here, they can definitely answer general questions, but this in no way replaces a comprehensive consultation with your doctor. And we absolutely urge everyone to make sure that they do that before they start fasting if they do have a medical condition. And so I just want to thank you all. Thank you, Dr. Khaldoon and Dr. Ahmed and Rashma as well. We would... A last question. We have a last question. Apparently we have a last question. Oh, yes. Okay. Let's see. This is about Fakeeh University Hospital. Is there a telemedicine solution to manage diabetes remotely during Ramadan and beyond?
Let me answer the question. Yes, we have telemedicine. We are having telemedicine, and I believe that our patient can check with the hospital about the availabilities of telemedicine for connection.
Fantastic. So as we have been saying throughout the webinar, all you need to do is go up to speakers and booths, and there you will get all of the information that you need to find out more about Fakeeh University Hospital and all of the fantastic services that they do offer, and perhaps even book your own consultations with Dr. Khaldoon, Dr. Ahmed, and Reshma, as well as many more world-class health experts at Fakeeh University Hospital. And the details are all up there as well. So thank you to all of you for joining the discussion with us today.
Thanks,
Thank you very much.
Thank you. And thank you so much to our amazing audience and the fantastic questions that have come through. And of course, this session is going to be available online on the Gulf News YouTube page as well later on, as well as other places on Facebook as well. We've seen people on Facebook coming on. My name is Sally Musa, and we all wish you a very blessed, holy month, and we will be seeing you next time. Thank you so much.
Thank you.
Thank you very much.